I looked myself in the mirror. I couldn't believe how swollen my neck was. And so I went to the hospital to find out what was wrong. And they'd done a number of tests on me and discovered they had cancer. Currently, I'm cancer-free, going on 2 years now.
That experience led Tom Ungerbuehler to have one of the most important conversations of his life. Thanks to a grant from Bethesda, Inc., Hospice of Cincinnati created Conversations of a Lifetime, a program to help people discuss their wishes for end-of-life care with their families and physicians.
Advanced care planning is the beginning of getting patients to think about what's important to them, who would speak for them if they couldn't speak for themselves.
80% of us feel that if seriously ill, we would want to talk to our doctors about end-of-life care. Yet only 7% report having that conversation.
There's so much more that can be done to make the patient comfortable and to really make sure that their end-of-life experience is as good as it can be.
It begins with training doctors to initiate conversations with their patients.
The whole end-of-life care conversation, it's just difficult. So I think for us to get the conversation started for them, to bring the subject up, to hear from me and our care coordinators how important it is to think about these things, I think in some ways it almost is a relief to them.
After the first conversation, a facilitator helps patients and their families document their wishes.
It made it so much easier to have the service available here to be able to talk openly and freely about my wishes and my concerns.
Patients' wishes are noted in their advance directive and Tri-Health electronic medical record.
They are able to access these documents across the continuum. They're able to look quickly and say, this is the patient's wishes, and then that also guides the medical care.
The project has a broad reach. Conversations of a Lifetime's goal is to create a conversation-ready community.
It's about starting a conversation that you need to have with your loved ones.
A grassroots effort is underway to engage young and old alike. In just its first year, more than 2,000 conversations have been initiated between patients, their families, and physicians.
I thought long and hard about it, my decision, what I want to see done and happen at my end of my life care. So there are certain things I wanted done that I knew my family would not be able to do unless it was written down.
When someone goes through the dying of a loved one, it's a one-time thing. There are no do-overs, they get no second chances, and if we can help make that a little bit better and more consistent with the patient's wishes, that's worth a lot.